The morning the abortion medication was delivered to my surgery, this January gone, is one I will always remember. Sitting at my desk about to start the day's appointment list, I took the package, opened it, and took out and spread out the tablets. Small white tablets, like any other. And I thought to myself, wow, it's actually happened. As a family doctor, I can now prescribe medication to any woman who comes to me pregnant, seeking an abortion, up to 12 weeks, without restriction, without fear of the law, without criminalization, without sending her away to another country, to the internet. I could now provide support to any woman or girl coming to me pregnant, no matter what decision she should decide to make. And I thought to myself as I sat there, wow, some journey, long at times. And today I'd like to share with you some of that journey, a journey that reflects Ireland, who we were, who we've become, and who we can be. But I need to give you a bit of context. In 1979, the Pope visited Ireland. A third of the population went to see him. I didn't. I worked in the local chip shop. There weren't very many customers. You couldn't mistake that we were a Catholic nation. Up to 90% weekly mass attendance, and Ireland exported priests. And we had an effectively complete ban on abortion in our constitution, effectively even when the mother's life was at risk. But in 1983, a proposal was made by the government to further restrict that in our constitution by introducing an amendment that said there would be equal weight given to the life of the unborn as to the life of the mother. No qualifiers. There were protests, and indeed I campaigned as a medical student myself. I can remember going up the path of this small terraced house, knocking on the door, and this man answering me, setting his dogs on me, and I ran out the path and got bitten, as he called, "Shame on you." We did a big line in shame in Ireland. We shamed you if you were pregnant and not married. Indeed, we shamed you if you were married and not pregnant. We shamed you if you were gay or a little bit queer. We shamed teenagers into grottos pregnant where they died. We shamed women out of jobs into mother and baby homes. We shamed them out of the country. And of course, the companion of shame is silence. And that's how we treated the subject of abortion in Ireland. Silence. Not here, not us, not our reality. So, further on from that, the result of the referendum, unfortunately, was passed by a very large two-third majority. Now, it's not entirely surprising. It was the time of contraception was actually illegal unless you were married. We had no divorce, and we had criminalized homosexuality. But the impact of that amendment, called the Eighth Amendment to the Constitution, was that basically it gave support to those who wanted to reduce and silence women's reproductive health rights. It empowered the church and the medical establishment to reduce and control and manage their bodies, their pregnancies, their choices. But of course, Irish women and people are resourceful, and we have Irish solutions to Irish problems. And our solution was that women travelled to England to seek abortion, where it had been legal since 1967. And our response to that, again, and how we maintained our Catholic moral authority, was silence again. A silence that we all effectively internalised, myself included. Why would I have been any different? Abortion was never on the medical school curriculum. Indeed, it still isn't today, but we're working to change that. And in 1992, a 14-year-old girl was pregnant because of rape, suicidal. Her parents wanted to take her to England to seek an abortion. They consulted the Attorney General for reasons of forensic evidence. The state prevented her from travelling. They took a Supreme Court challenge, and they won. They established her right to travel to seek a service that was legal in another country. 10 years on, 2002. We now have another attempt at a referendum in this country, in Ireland, because what they wanted to do was to challenge that Supreme Court ruling and make sure there was absolutely no wriggle room that a suicide claim and a risk to the life of the mother could ever be used as a reason for abortion. So, what would we have but the airwaves, the media, full of medical talk of mental health and depression and the risk of women faking suicide. And I was talking to 2 other doctors one day, and we were complaining about it. And we decided we'd had enough. We'd had enough that the only voice you heard, the only medical voice you heard on the airwaves was a conservative voice, a Catholic voice, a usually male voice. And we knew that it could be different. We knew that there was a different medical voice, and that it was important that the wider community heard that. And so Doctors for Choice began. And we were a small but active organisation, and we developed evidence, we debunked myths, we gave talks, we gave interviews. And one of the things that we established that was the most effective thing we could do was actually telling our patients' stories, telling their truth. So I told stories, true anonymized stories, whenever I was interviewed, of the situations my patients found themselves in, the stress, anxiety, and harshness of having to book flights, having to find the money up to €1,000, airline strikes, ash clouds. And I will never forget the mother of 2 small children. She had brought her little boy to me earlier in the week, chest infection. And now here she was sitting with me a few days later, and I needed to admit him to hospital with pneumonia. And she looked at me, and I looked at her, and we both knew she was taking a flight in the morning to England for an abortion. And how could she now spin her story that she'd won a shopping trip on the local radio station? And I will also not forget the 16-year-old girl who travelled the length of the country from an offshore island with her mother to find a GP she could trust. And she'd heard me on the radio. A young girl and her mother forced to travel for the second time. So all of this was fine, but it didn't actually make much difference. We didn't make much progress in promoting abortion reform in Ireland, and very little changed for the thousands of women who continued to travel to England to seek abortion and increasingly sought medication on the internet. Safe medication, but taken in circumspect, clandestine, unsafe circumstances. So, across the summer of 2012, there was really very little happening in Doctors for Choice. People had moved on, moved away. I was largely the only person left. And I remember having a conversation across my kitchen counter with my partner. Should I fold up Doctors for Choice? Was there really any point? I wasn't doing very much. There wasn't really actually very much to do. But the decision was no. Keep it going, keep the voice. It's really important for people in the wider community to know that doctors and the medical profession do support abortion reform in Ireland. Then 7 o'clock in the morning, one morning in November, phone call from a reporter in the BBC asking me about the Savita Halapanava case. What were my thoughts? I didn't know who she was. I didn't know what he was talking about. Her death was on the front page of that morning's Irish Times. I don't know why the death of Savita bothered us so much. Savita Halapanava was an Indian-born dentist. She was admitted to hospital in Galway, 17 weeks pregnant. She was miscarrying. The doctors quickly found that it was inevitable miscarriage. And the reason for the inevitable miscarriage was because the neck of her womb was open and the fetus could not possibly survive. She couldn't have an abortion because the fetal heartbeat was still there, the Eighth Amendment. An abortion she actually requested when she knew the situation was hopeless. 3 days went by, 4 days. She became increasingly unwell. She developed septicemia. And on the 5th day, the fetal heartbeat stopped. And eventually, an abortion was scheduled finally. But she died before it could be completed. The death of Savita affected this country. It affected how we thought about abortion. It was no longer other. Candlelit vigils became protests, and protests became the first campaigning to repeal the Eighth Amendment. Doctors for Choice got busy again, and we went back to telling stories and describing the patient's voice, telling their truth. But we tried another tack. This time we tried to target and influence the thinking of the medical establishment. So we leafleted the business meetings of our professional organisations, and they changed the rules so that we couldn't do it the following year. We presented motions, very limited abortion motions, to the annual general meetings, and people were bussed in to outvote us. Very hard to change the thinking in a conservative profession when it's deeply immersed in shame and stigma. But we did get some support. You're doing a great job, Mary. Keep going. I think that's great, Mary. That's good, but actually, I couldn't do what you're doing, Mary, but you keep doing it. And of course, the antidote to shame is empathy. I once saw a fantastic description of if you took 2 Petri dishes and you put a dose of shame into each of them. And in the first one, you applied judgment, criticism, silence. In that one, the shame would wither and die. And if in the other one, getting the mix up, that one, the shame would grow and prosper. But in the other one, if you applied empathy to the shame would wither and die. And I think that's actually a metaphor for the Repeal 8 campaign in Ireland. It's a metaphor for the journey we went on as we addressed this whole issue of sexuality and abortion in Ireland. And in focus group work and polling that was taken of voters before the campaign and as it was developing, a central theme developed. That was that the voices the voters wanted to hear and would respond to was the patient's voice and the doctor's voice. The woman telling her experience, her truth, and the doctor supporting that with facts and their own experience of how the Eighth Amendment impacted on women's health. So, as Doctors for Choice, we made sure that we countered that not here, not us, not our country, not our faith, not our community, with the reality that at least 1 in 10 Irish women had had an abortion. And that in actual fact, termination of pregnancy was the most common gynecological procedure an Irish woman could ever have. And across the country, voices developed. Many, many voices. The campaign was called Together for Yes. So we had parents for choice and grannies for choice. We had farmers for choice and lads for choice. And voices developed across the country that told stories of people's truth, which was of women and men travelling to England with a pregnancy of fatal fetal anomaly and bringing home their small baby in a box. We had enforced pregnancies of asylum seekers because they didn't have the papers to travel. We had women wheeled to the steps of airplanes, so ill, travelling to England for abortions. And in the last weeks of the campaign, many, many doctors found the courage to give their voice to a call for repeal, to say that yes, the Eighth Amendment did affect the care they could give to women in Ireland. And over 1,000 doctors signed a petition calling for repeal. Bringing the subject of abortion out into the open in Ireland and allowing us hear people's stories, walk in their shoes, allowed us express empathy. And then the Irish people took that empathy to the polling stations, voted in really large numbers, and a significant 2/3 majority voted for change. Some journey from the impossible to the possible. And in the time since that historic day, many people have asked me, what made you do it? People have called me a leader. I'm not naturally a showy person. I'm not naturally somebody who wants to put myself out there. But for this I would, and for this I did. I think as a society, we actually make too much out of leadership. We make it bigger, superior, different, something other. Well, what I do believe in is the importance of solidarity and the importance of showing that. And I knew from my position of medical training and privilege that I could make change happen by making the medical knowledge that we had, known to others. I think leadership is about telling the truth. And I knew I had to. And it was a privilege to do it. This campaign, the repeal campaign, was won by small leaderships, many, many small leaderships all over the country. No one organisation, no one person. It was individuals realising that their small actions could actually make change happen. Success, in the end, was a collective achievement. Doctors for Choice was always small. But it turned out that making small seem big was an important part of effective leadership. Our end game was never the members. It was always influence. It was never the numbers. It was always the message. The message that the medical profession did care, that we were together for yes. Empathy was the heart of this leadership through solidarity. A solidarity that allowed us all acknowledge our vulnerability. The vulnerability that comes with uncertainty, risk, emotional exposure. A vulnerability that acknowledged that we all were on this journey, that we too had internalized the shame and stigma and working our way out of it on the journey with the entire Irish population as we changed. It was also a solidarity that carried us, lifted us, and continues to take us forward. It allowed us make mistakes, not always be sure, but get support from others. It had an empathy that allowed us recognize that the flip side of vulnerability is courage. A courage to tell the truth, to hear the truth about abortion in Ireland, about our journey from the impossible to the possible, from the 8th Amendment to tablets on a doctor's desk. Thank you.